Okay.
So let's get rolling. So before we go into the next part of the SDT, or the special dentures technique, I want to talk a little bit about terminal dentition and the relationship between terminal dentition and how are we going to restore a terminal dentition. And as Dr. Van and I were getting ready for to shoot the videos on custom trays and stuff like that, I happened to find some models that probably the seniors and the juniors have taken of some patients. And I wanted to see, I was a little surprised on the very well techniques they use for pouring up models, and a lot of care they do of taking them off soon enough before alginate goes into a rock station, right? But anyways, let's not, guys, don't look at the horrible ways of pouring up the models. Let's look at the teeth like this. And the first one I want to show you, it's this guy. We don't know who he is. We don't know if it's a guy or a girl. We don't know if it's 25 or 75. The only thing we know is that there's some teeth missing. There are some problems that we see all around, right? And let's pretend, only pretend, that this patient is in a terminal dentition, which I think it is, but let's just pretend. And we see a lot of periodontal disease on this side. We see big mobilities on this other side. And we need to figure out what are the treatment options we have for this patient. And let's go first on this upper arch, right? You can see it well right there, right, Wally?
Mm-hmm, yeah.
Okay. So for this situation here, there's not much things we can do about this. And let's pretend these 3-4 remaining teeth have mobility class 4, it has severely periodontal disease, right? And if I dare to take an impression or a final impression with an elastomeric material, maybe I will be doing or performing some good extractions by impression, which we don't want to do that because we don't have the patient anesthetized, and that's not the way we do extractions. So what are the options we have? Well, one of the options we have is to fabricate a custom impression tray to fabricate. These would be the precise case or a very good case for an immediate denture. An immediate denture would be, or that means that on the time that we perform the extractions of these remaining teeth, I will be delivering a complete denture, okay? So that means that I have to have that denture finished, processed, and ready to be delivered prior to the extractions of the teeth. So what am I going to do? Well, I need to fabricate that denture with these teeth in. So what an immediate denture means is we have to do the border molding, we have to do a custom tray, we have to do border molding, we have to do final impression, we have to extract the teeth on the cast, do and fabricate, set up the teeth, process, finish before we go to the surgery day.
And of course, we mount the cast to do all of that too on an articulator.
Exactly.
So we can do the occlusion correctly.
Of course, I mean, there's no doubt about that. So this is why special dentures technique, or this course, will teach you how to do, okay? In this case, in a normal edentulous patient, we will take preliminary impressions, base plates and wax rims. Preliminary impressions, custom trays, final impression, base plates, wax rims, tooth trying, and final delivery, right? In this case, we're gonna take preliminary impression, which is what we have. On the preliminary impression, we will fabricate a custom impression tray. That custom impression tray will give me a final model, final cast. I will perform I will take the MMR records, mount that on the articulator, and then make the extractions and fabricate that denture. I don't have a tooth trying. I could, but technically.
Well, you might have to try the record base and wax rim and to verify your mounting.
Verify the mounting?
But you could have some teeth on it, but not many. You can't have all of them because they haven't been extracted yet.
Exactly.
They won't go in the mouth.
In
Yeah.
this case, right, Wally? In this
Yeah.
case, I can do an aesthetic try-in, right? Because it would not interfere. I don't even know how that goes, but it will not interfere with the treatment.
Might not even be the same patient for that matter.
Yeah, you're right. So anyways, I wanted to show you, so this is a very straightforward case. Now, in these other, for the lower portion, probably this patient may be able to keep a few of the teeth, and we'll have to perform multiple extractions. For these multiple extractions, we can also do something, it's called the interim prosthesis. An interim prosthesis, it's kind of like a immediate prosthesis to where, do certain extractions in the mouth and then deliver a interim prosthesis with the extractions that we
They actually
perform.
do have a code now for an immediate RPD.
Okay.
Yeah, so which includes the fact that you can make them another RPD within a certain amount of time. In the
Excellent.
past, you couldn't. It was like a cast metal RPD, and whoops, you got to go 5 years before you can get another one, and that wasn't very fair.
In the school, whenever you get an immediate complete denture, or like Wally's saying, an immediate RPD, at the same time, the patient's paying also for the definite one. So when you code this on your senior and your junior year, when you start doing patients, this will be part of the treatment. Now let's move over to the next patient here. And this patient has also, let's pretend this patient has also a severe periodontal decay or
Situation.
disease, right? To where I pretty much have to do full mouth extractions. Well, it's going to be a little bit more complicated for me to fabricate a complete denture with so many teeth. And in these cases is when it's very, very convenient to perform staging extractions. And what do I mean by staging extractions? Well, I'm going to stage the treatment in different phases to where I may go into surgery and do extractions of the posterior teeth, let the patient heal those sites, and then after that I could go ahead and start doing an immediate complete denture.
We call sequential extractions.
Sequential
The
or
terms we like to
staging,
use.
exactly. So
Stage.
that's another way to see this, and you guys will be exposed to all these different kind of treatments. Sometimes we just have to go ahead and extract all the teeth, make the surgical procedures needed to deliver or to obtain a nice residual bridge, let the patient heal without nothing on, and then after 3 months of healing, you can start just doing a regular complete denture. So those are the options we have for the special dentures techniques. Now, let's cut these